everyone, I am Dr. Govind Gandhi, orthopedic surgeon in Udai Omni Hospital here in Nampally. So today I am going to discuss about the hip arthritis and hip related issues. So after Corona, a lot of people, they would have taken steroid and other medication as a part of a treatment. So after that, they are developing the arthritis of the hip, and a lot of young people now coming up with the AVN, that is avascular necrosis of the femoral head, where the blood supply of the femoral head becomes hampered, and it ultimately lands up into the arthritis of the hip. So they come to us with the hip pain, not able to walk properly, and inability to carry out daily activities of the living. So in such cases, the ideal treatment for that is the total hip replacement. The total hip replacement is a beautiful procedure wherein we replace the surface of the joint, the two surfaces of the joint, like on the cup side as well as on the ball side. So once you replace the cup and the ball, the pain, there is no friction. Now the hip become the congruous, and there is no pain at all. And it's a beautiful procedure wherein you can walk very next day, and you can expect walking without any support within a week or two. So a lot of people, they have myths regarding the hip replacement surgeries, like they're not able to walk, they will not be able to walk, or they will be like a bedridden and all. But believe us, it is like a simple procedure where it changes your hip range of movement and painless movement, and it is a beautiful procedure. So a lot of time what happens is the hip issue and the back issue, it comes together. So you have to identify whether it is coming from the back or whether it is coming from the hip, number one. If it is from a back, it can be because of some sort of a postural issues, or some work habit, or because of their profession, like a lot of IT people who are sitting in front of computer for hours together, and like drivers who are driving the vehicle for 8 hours to 10 hours to 12 hours in a day. So in that case, it becomes a very for them to have a back pain is a common thing. So first of all, you have to rule out whether the back pain is because of the mechanical back pain, or whether it is a radicular back pain, which you usually called it as a sciatica, and based on that you have to treat. Apart from that, you have to rule out the other causes which can mimic like a back pain, like a hip pain, and the pain which is radiating from the up. So this thing needs to be ruled out. Once the patient comes, we assess them, and then we do the necessary investigations, come to a conclusion, and then accordingly we treat. Yes, for hip arthritis, basically, fortunately, it is not that common as a knee arthritis. So a lot of people, the people who are developing degenerative arthritis of the hip is little less. But unfortunately, because of the AVN, avascular necrosis of the femoral head, a lot of people, they are coming up with the secondary arthritis of the hip, for which the surgery is required. But if you want to avoid all this pain in future, then definitely keep yourself healthy, do exercises, walking, squatting, don't climbing stairs and up, don't avoid the things. Because as soon as you start avoiding things like squatting on the floor, or sitting on the floor, climbing up and down stairs, so basically you are not using your joint to your fullest, and ultimately the damage starts. So my suggestion is, don't stop yourself from doing activities as long as you're not having pain. Of course, if you are in pain, then try to avoid it.